Okay, so insyaAllah malam ni saya akan share dalam masa setengah jam. Okay, ini adalah salah satu soalan yang biasa ditanya oleh medical grads, okay, di mana-mana seminar ataupun waktu clinical skills workshop, okay, ataupun peserta-peserta yang pre-show online. Okay, biasanya yang tanya ni adalah yang dah nak start houseman. Okay, so yang tanya, betul ke waktu tagging ni kita dah in charge patient ke tengok-tengok je ke? Okay, so saya akan share malam ni insyaAllah 3 main point. Okay, so first you kena tahu apa definition, apa yang bila kita cakap in charge patient tu maksud dia apa. Okay, next tentang tagging. Okay, banyak misconception tentang tagging ni, so kita akan bincangkan bersama-sama lah. Okay, next is what do you need to learn during tagging. Okay, so ada 3 point yang saya akan cover dalam masa 30 minit insyaAllah. Okay, sebelum tu boleh tak yang dah join ni komen apa yang you all faham tentang tagging. Okay, sebagai taggers, apa yang you all kena buat waktu tagging. Okay, share dekat komen. Seminit saya nak tengok you all apa yang you all faham tentang tagging dulu, baru kita continue. Okay, anyone ada yang nak share apa yang you all faham tentang tagging? Okay, so kita continue dulu. Okay, so first, what does in charge of patient means? Okay, so in charge of patient ni maksud dia, okay, first you need to know the case. Okay, so berapa case yang biasanya houseman kena tahu atau kena cover. Okay, so biasanya kalau ikut department, based on pool yang saya buat sebelum ni, biasanya kalau contoh medical department, houseman kena in charge. In charge ni maksudnya kalau pagi tu berapa kes yang you all kena review. Okay, waktu pagi. Kalau medical biasanya 8 ke 12. Okay, so if you are seeing less patient is luxury. Kalau more than that mungkin you punya workload lebih lah. Okay, mengikut berapa houseman yang ada dan whether your ward is full or not. Okay, so medical biasanya 8 ke 12. Okay, ONG more or less the same. Pediatric biasanya half than that. Okay, surgical base, orthopedic pun usually half than that. So biasanya medical ONG 8 ke 12. Okay, ada ward, okay, mungkin 4 to 6. Okay, depending on your ward and number of housemen you have. Okay, currently. Okay, so first, bila in charge patient ni, okay, kalau you jaga satu cubicle 6 ke 8 patient, means semua patient tu you kena tahu case dia lah. Tahu case ni bermaksud patient ni apa diagnosis dia, dah berapa lama dalam ward. Okay, kalau long staying patient, okay, kalau taggers ni biasanya kita akan bagi chronic cubicle, maksudnya patient yang relatively stable tapi selalunya patient tu dah agak lama dalam ward. Okay, mungkin seminggu, mungkin sebulan. Okay, so you need to know why the patient here and what keep the patient in, why we still keep the patient in the ward lah, kenapa tak boleh discharge lagi. Okay, okay, so you need to know all your cases. So kalau 4 patient lah, kalau 12 patient lah. Okay, and then when you in charge of the patient, okay, you need to do review of all your patient. Okay, so kalau AM round tu, kes yang you dah tahu tadi, contohlah patient ni masuk sebab pneumonia. Okay, update progress ni bermaksud whether the patient still have active symptoms. So kalau pneumonia ada SOP lagi tak, ada fever lagi ke tak, what are the signs, so ada lung spinal auscultation. Okay, what is the input output chart. Okay, kalau patient yang kita monitor urine output, apa input output chart, physical finding tadi. Okay, signs, relevant investigation for those case, and what's your plan lah, what's your plan based on your review tadi. Okay, and then after the round, okay, what you need to do is execute all active plan. Okay, so active plan ni maksudnya benda yang kena execute lah, sebab ada certain case kita just continue previous plan ataupun continue medication, so tidak ada active plan yang you kena execute. Okay, kalau active plan ni contohnya houseman kena take blood investigation. Okay, kalau start antibiotik kita kena insert ranula. Okay, next is all newly prescribed medication you need to endorse, okay, and make sure they are served accordingly, okay, on time lah. Next, any request or operation you need to request as a houseman, okay. Usually kalau scan, we need to fill in the form and go down to radio department. Operation usually you need to call up the NS team lah, okay. And the same goes to referral, okay. Referral to other department, so you kena call up the respective medical officer or specialist. Okay, next, execute procedure. Okay, simple procedure macam continuous bladder drainage, dressing, itu houseman boleh perform sendirilah. Okay, but more invasive procedure macam chest tube, central line, okay, most of them you need to assist your MO lah, okay, ataupun you do under direct supervision by your MO. Okay, so and jangan lupa kes-kes yang dah boleh discharge, you kena prepare discharge lah, okay. So this is what we meant by in charge of patient. So kalau you jaga patient, you kena tahu case, you kena update progress dia. Okay, sekarang patient macam mana, okay, berbanding semalam, and execute all active plans. Okay, so macam saya mention tadi, number of patient yang you jaga bergantung kepada you punya cubicle lah, cubicle, okay. Kalau you jaga satu cubicle, mungkin half cubicle kalau you newly tagging, okay. But the good practice is you know all the cases in your ward, okay. So kalau ada 3 houseman, by right semua 3 houseman tu tahu, you know in general, okay, cases dalam you punya cubicle tu you kena tahu in and out. Tapi ada cases in other cubicle, you need to know the case, okay. Means you tahulah kalau dekat you jaga chronic kan, tapi acute bed tu you kena tahu, okay, acute bed ada 3 MI case, okay, satu lagi apa, DKA, okay, another one apa, okay. So you need to have some idea on the cases as well, okay. Sebab apa, nanti mungkin ada specialist from different department akan datang review case tu while you're active, while you're in charge houseman, tengah pergi run for blood ke, read ABG ke, so you still need to know the case, okay. Satu lagi biasanya mungkin hari ni you jaga chronic, okay, after few days mungkin you kena jaga subacute and acute cubicle pula, okay. So it's good to know all your cases in the ward, okay, so that you can help your teammate and untuk prepare kalau you in charge patient tersebut juga, dan ultimately is for your exposure and learning lah, okay. Okay, so that's it about in charge of patient, okay. So next, kita tengok pula tagging tu macam mana, okay. Dan kita tengok bila you faham tentang tagging ni, nanti dia akan jawab soalan whether kalau tagging ni kena in charge patient ke tak, okay. Okay, so what is tagging? So Khairul Syahmi Mohtar dia bagi tahu tagging time adalah untuk kenal sistem hospital, okay, untuk first poster dan mengenal basic things emergency each department in order to on call. Okay, betul. Okay, tagging time ni, okay, is first 2 week of the posting, okay. So usually kalau first posting compulsory 2 weeks biasanya, okay. Kalau tak cakap houseman, mungkin you boleh kena off lagi awal kalau progress tak begitu excellent, mungkin kena extend lah according to your progress, okay. So usually it's 2 weeks, okay. Second point yang penting adalah kita kena faham bahawa bila you tagging ni, you dah masuk dalam ward. Bila once you dah masuk dalam ward, you are another houseman in the department. You need to remember that this is not the time for tengok-tengok. Okay, ramai medical grads atau medical student, dia ingat waktu tagging ni akan kena tengok-tengok saja, ada orang tunjuk, ada orang ajar. Okay, yang itu, that term is shadowing. Okay, shadowing ni you memang macam bayang je. Macam tak ada pun tak apa. Okay, you ada hanya untuk observe. Okay, yang itu apa yang biasa medical student buat. Okay, bila you dah jadi houseman, you dah tagging, most of the time bila you masuk department, tagging means you need to do what any senior houseman supposed to do. Okay, so kita akan tengok lebih lanjut lah. Okay, next important point is, okay, kenapa kena tagging ni? Sebab sebelum ni ada yang pertikaikan lah. Okay, keperluan tagging ni sebab long hours, biasanya mentally tiring, physically tiring and emotionally tiring as well. Okay, especially lepas waktu menunggu sebenarnya yang lama, few months up to 1 year biasanya. Ada yang kerja, ada yang lepak dekat rumah apa semua kan. So, tiba-tiba you kena kerja berterusan selama 2 minggu. Okay, berterusan selama 2 minggu. Mungkin ada off day setiap minggu 1 hari. Kadang-kadang tak ada off day. Okay, depending on your department. But aim dia adalah supaya you jadi aim to be safe for independent shift after off time. Okay, so kena belajar betul-betul dan belajar sebanyak mungkin. Sebab apa? Waktu tagging ni adalah masa yang agak selamat untuk belajar. Sebab apa? You akan sentiasa ada dengan senior houseman. Okay, kalau you pagi pukul 8 sampai pukul 5 tu, dalam ward tu akan ada beberapa houseman lah. Okay, malam pun you tag after 5 till 10 PM akan ada senior houseman yang night shift. Okay, so akan ada, sentiasa ada senior houseman untuk you tanya. Okay, ataupun you double check apa yang you buat lah. Okay, so next, kena faham apa perbezaan taggers dengan senior houseman. Okay, so biasanya you all dah tahu yang tagger ni balik lambat. Okay, datang awal balik lambat. Okay, kenapa datang awal balik lambat? Usually punch in untuk houseman adalah pukul 7 pagi. Okay, tetapi kena faham certain MO dia datang awal. So by right, before your MO come, you kena habis you punya round lah. Kena dah tahu kes, habis dah update progress patient, dah check patient, dah tanya, dah apa ni, update dia punya investigation dan dah ready untuk present dekat MO. Okay, so kalau MO datang lebih awal ataupun you cover patient ramai, biasanya kena datang awal lah, even for senior houseman. Okay, jadi bila kita taggers, biasanya kita lebih lambat daripada senior houseman. Okay, lebih lambat daripada senior houseman sebab kita tak biasa. So biasanya itu menyebabkan ada taggers yang datang pukul 5 pagi. Okay, dan balik kalau senior houseman dalam slide tu sebenarnya 7 pagi, 7 AM sampai 5 PM biasanya AM shift. Okay, itu untuk senior houseman. So bila you tagging walaupun daripada pukul 8 pagi sampai 5 petang tu, job scope adalah sama macam senior houseman. Cumanya biasanya senior houseman dia in charge dekat acute cubicle. Okay, biasanya kita bagi taggers ni kes-kes yang lebih stable lah. Tapi ada juga saya banyak kali encounter first poster terus kena jaga acute cubicle, ataupun second poster masuk department baru terus kena jaga acute cubicle. Okay, especially bila tak cukup houseman lah. Okay, ada yang tanya, saya tengok dekat komen sekejap. Muhammad Irfan tanya, bermaksud tagging ni di setiap satu posting? Yes, setiap kali you masuk posting baru kena tagging. Cumanya posting kedua dan seterusnya dia bergantunglah. Kalau di hospital saya dulu di HSE Johor Bahru, first poster mesti 2 minggu, subsequent posting medical base seminggu sahaja, Tetapi kalau surgical based department macam ONG, ortho dengan surgery, regardless you posting ke berapa, kena tagging 2 minggu. Sebab apa? Kalau di surgical based department, you bukan sahaja after 5 tu you kena tagging dekat ward, you kena tagging juga dalam OT. Okay? So you kena tahu macam mana nak assist common operation, nak buat OT notes. Okay? Ada certain rule announcement kena tahu dekat tagging, dekat OT, sorry. Okay. So Heng Lee tanya, is it true that first poster will have longer tagging period? Biasanya tagging period dia usually is standard 2 weeks, okay. But if your department is really tak cukup announcement, okay, so mungkin 7 hari atau 10 hari dia dah minta you off tag supaya you dah boleh masuk dalam roster. Bila off tagnya, you boleh masuk dalam roster means you boleh kerja malam sendiri, okay. You might be in charge of the whole ward, or you might be assisting, macam you seorang je assist you punya MO dalam operation theatre, okay. But usually first poster will have longer tagging period because we need more time to adapt with the system, okay. So bila you first poster, kita tak pernah isi borang, kita tak pernah ambil blood, okay, kita tak pernah review, kita tak tahu lab dekat mana, kita tak tahu nak run for blood dekat mana. So you need more time to learn all these things. Then especially if you are doing your housemanship in computerized hospital with IT hospital computer system lah, okay. So you will need more time to adapt to the technicalities, macam mana nak order blood investigation, macam mana nak trace note patient, okay. That will need more time, okay. Faris, okay, next Faris Irfan tanya, of the assessment tu biasanya format dia macam mana? Saya akan bagi contoh sekejap lagi. Contoh tagging log, tagging form, okay, dan of the assessment kita akan sentuh sekejap lagi, okay. Okay, next Mama Irfan tanya lagi, after off tag in night shift, is it only HO jaga the whole ward without MO? Okay. So you kena faham ni once dah off tag lah, once dah off tag night shift. Okay, night shift. Biasanya ward dijaga oleh houseman sahaja. 1 atau 2 houseman itu bergantung kepada ward you besar mana dan berapa houseman kita ada lah. Okay. And sometimes kalau you punya department besar, kalau macam contoh ONG department lah, waktu saya houseman, kalau you jaga gynae ward, you kena jaga antenatal. Okay, so dia macam combine. Kalau you jaga postnatal ward, you jaga low risk postnatal center as well. Kalau you jaga labor room, you kena jaga HTU labor room. So actually kadang-kadang bukan satu ward, it's a few a few ward ataupun beberapa area lah, okay. Kalau PAC dengan HTU labor room, okay. Mungkin 1 houseman, mungkin 2 houseman, mungkin 3 houseman, bergantung kepada berapa ramai patient yang you kena cover dan berapa houseman yang ada lah. Biasanya bila you baru, houseman yang baru, fresh off tag, kita akan letak at least dengan 1 senior houseman lah, kalau cukup houseman. Tapi ada possibility untuk lepas off tag, you kena seorang-seorang jaga ward, okay. MO, okay, MO usually okay, you bayangkanlah kalau medical mungkin ada 4 ward, 2 ward lelaki, 2 ward perempuan. Biasanya 1 ward mungkin 1 atau 2 houseman. MO dia akan oversee all the 4 ward. So biasanya MO tidak ada dalam ward lah. Dan you kena faham MO ni dia jaga ward dan dia kena tengok patient dekat referral dekat emergency department, mungkin referral dekat ward lain, okay. So biasanya waktu night shift, MO tidak ada dalam ward. Okay, cuma you boleh call lah. Usually on-call people are readily available. Kalau ada patient yang tak stable ke, you attend and you call for help, usually MO akan datang. Okay, di hospital-hospital yang lebih besar, mungkin satu malam on-call yang MO yang on-call pun ada beberapa MO lah. Okay. Okay, so back to about tagging tadi. Okay, so kena faham tagging ni, bila you taggers during office hour tu, kerja kita sama macam senior houseman. Senior houseman ada patient, kita pun ada patient. Senior houseman kena review case, kita pun kena review case. Kena isi borang, kena refer, kena request scan, kena buat prosedur. Cuma kalau you tak sure sebab you baru, akan sentiasa ada senior houseman untuk you tanya, dan mereka, hopefully mereka akan bantulah. Okay, so usually you will never be alone during tagging period. Okay. Okay, next. Okay, what happened after 5 p.m? Okay, so after 5 p.m, houseman yang AM shift sahaja, dia akan balik lah. Okay, dan digantikan dengan houseman yang extended shift ataupun houseman yang PM atau night shift. Okay, jadi apa yang houseman kena buat? Okay, so biasanya lepas pukul 5 ni, there will be a set of things you need to learn. Okay, most department dia akan ada tagging form atau tagging log. Saya akan tunjuk kejap lagi. These are list of diseases or list of procedure you need to do within your tagging period. Okay, usually within 2 weeks lah. Okay, so kalau medical base macam medical dengan pediatric, so you kena tagging dalam ward lah, means you need to learn how to clerk common cases. Okay, kalau case baru, kena tahu nak clerk macam mana, nak examine macam mana, nak order investigation apa, and apa plan yang standard biasa kita buat untuk kes-kes yang baru masuk dalam ward lah. Okay. Okay, and then kalau surgical base department, okay, dalam masa 2 minggu tu you tagging mungkin ada 3 ke 5 malam, maksudnya 5 to 10 tu 3 to 5 days you kena pergi tagging dekat OT. Okay, assist common operation punya case lah. Okay. Okay, so macam saya mention tadi, advantages as taggers is bila tagging ni you akan sentiasa bersama-sama dengan senior houseman. Walau kalau AM shift waktu siang tu memang senior houseman ada lah, dan kalau malam pun waktu you tagging tu, kalau you pergi OT, ada senior houseman yang sebenarnya kerja night shift untuk assist MO, so you can learn from the on-call houseman or night shift houseman and on-call MO as well. Okay, so sebab itu you kena faham yang kita tagging ni untuk pastikan kita safe for independent shift after off tag. So you boleh assist OT independently, you boleh do the common procedure independently, sebab mungkin you jaga ward perseorangan, atau kalau you tak jaga ward seorang pun, bila you in charge PM atau night shift, mungkin 2 orang saja houseman dan you kena cover satu ward yang mungkin 20 ke 30 patient lah. Jadi mungkin tak sempat you punya senior houseman tu untuk oversee each of thing yang you perlu buat lah. Okay, so sebab itu penting waktu tagging tu kita belajar betul-betul. Okay, ask as many question as you can, try as many procedure as you can, sebab waktu tagging ni akan ada lah orang yang akan tengokkan you buat observe you do that procedure because you are still new. Okay, bila off tag, okay, so you dah kena buat sendirilah, be independent. Okay, so next, this is example of off-tag assessment. Okay, some department, bila you masuk je first day dekat department tu, dia akan bagi off-tag assessment, ataupun kalau kita tengok contoh lagi satu, ini adalah tagging form dekat pediatrics. Okay, ini medical. More or less the same requirement dia, form dia mungkin berbeza-beza. Okay, so advantage dia adalah kalau first day diorang dah bagi kat you, okay, ataupun certain department tu memang dah ada dia punya off-tag assessment macam ni. Kalau ada kertas macam ni, okay, so waktu hospital orientation, before start tagging lagi, biasanya towards end of you punya hospital orientation tu, you dah tahu you dah buat posting mana, so you have few days before you actually start tagging untuk you kind of study lah apa you punya off-tag assessment ni. Okay, so kalau medical, usually they want you to learn how to identify common emergency and how to attend those cases lah, sebab bila you off-tag ni, you yang in charge, you yang ada dekat ward, so you should be able to identify which patient yang unstable and apa yang you perlu buat sebagai houseman lah. Contohnya kalau patient develop shortness of breath, what you need to do. Okay, kalau patient ada hyperkalemia, what are the set of things you need to do, and accordingly inform your MO lah, okay, before you proceed with the management. Okay, kalau chest pain, okay, nak assess macam mana, hypertension, hyperglycemia, blood taking and sending blood for transfusion. Okay, so dalam masa 2 minggu tadi, pagi tu you buat kerja macam senior houseman lain, you belajar clerk case, okay, dan you kena pastikan juga malam tu ataupun sepanjang daripada pagi sampai malam tu akan ada patient yang develop shortness of breath, ada patient yang hyperkalemia. So you tengok macam mana you punya houseman dengan senior houseman dan MO handle those cases tu. Okay, so Mama Irfan tanya, who will assess us during of the assessment? So siapa yang assess lah. Okay, so dia ikut department. Okay, usually kebanyakan department kalau off-tech assessment ni is by MO. Okay, so MO akan usually biasanya oleh MO. Kalau off-tech assessment biasanya MO. Kalau end of posting usually specialist atau consultant lah. Okay, take home message is, bila you dah tahu you masuk department mana, ask from your senior houseman whether they have the off-tech assessment ataupun tagging form. Okay, so you tahu apa list of things you need to know and a list of checklist of things you need to learn during the 2 weeks period. Okay. Okay. Okay, next. Ini contoh pediatric. Okay, so kalau you boleh tengok, kalau pediatric, depending on your hospital, some hospital they separate tagging in general pediatrics and tagging with neonates. Okay, ada yang for the hospital they combine both lah. Within 2 weeks you need to tag in both general pediatric and neonates. Okay, so there's list of common diseases you need to know how to clerk, okay, and how to examine or the investigation and make a plan of management. Okay, and also there's list of procedures you need to do. Okay, and usually you need to do more than once lah. For example, branular insertion. So neonate at least 3 attempt, infant at least 3 attempt, toddlers at least 3 attempt ABG. Okay, so apart from doing any daily or daily work or in charge of a patient during the day, you need to make sure that all this form, so you need to catch all these procedures during your 2 weeks of tagging. Okay. Okay, so saya tengok komen sekejap. Okay, so Kimberly commented. Okay, so knowledge can be gained over time, but most important is attitude and keen to learn. Okay. Okay, so kalau if you ask properly, show some initiative, there will be people willing to teach you. Yes, betul. Okay. So sebagai taggers ni, dan you kena faham bila dekat dalam ward, memang senior houseman, MO, staff nurse semua busy lah dengan kerja mereka masing-masing. Okay, lagi-lagi waktu COVID ni, ramai healthcare staff yang kena quarantine, so we need to work with less number of staff. Okay, so kalau you baru, orang tak kenal you unless you introduce yourself to your team. Okay, dan kalau you tak bertanya, so dia orang tak tahu, you ada ke, you tak tahu ke, you tahu ke, so you need to learn, and that's why it is very important for you to know what is expected from you. Okay. Okay, next Akila Rahmat tanya, time tagging kena present case time round macam biasa ke senior HO yang akan present dulu dan kita observe? Okay, Akila. Okay, usually you kena faham, kalau you masuk department tu, bermaksud department tu biasanya tak cukup houseman. Okay, so most of the time, even in your first few days of tagging, you dah dapat patient yang you kena in charge sendiri. Okay, so kalau kebetulan ramai announcement, mungkin you in charge half cubicle, so 3 ke 4 patient. So case-case yang you in charge means macam saya mention tadi, you kena tahu case, you kena review. Bila MO datang, you will need to present to your MO. Senior houseman dia akan in charge, dia akan present case yang dia review lah. Okay, dia orang in charge cubicle mana. Okay, so kalau you in charge half cubicle, another half cubicle tu, half cubicle you present, you round and you present, half cubicle senior houseman round and present. Tapi kalau memang tak cukup orang, you jaga satu cubicle you seorang. Okay, 6 patient. Okay, so you kena pastikan you review dan you tahu 6 patient, dan bila MO datang, you kena present all those 6 patient lah. Okay, but biasanya MO ni dia tahu more or less patient yang kronik ni dah few days dalam ward, sebab MO dia round hari-hari di ward yang sama. Okay, so dia dah tahu lebih kurang kes tu, cuma dia nak tahu latest update lah. So daripada semalam patient punya symptoms macam mana, investigation macam mana, any new scans or procedure yang kita buat, apa dia punya result, okay, atau dia punya report tu, you kena update MO lah. Okay, memang you kena present sendiri. Case yang you review, we expect you to present to MO. Okay, kalau you dah present dekat MO, round dengan specialist, mungkin MO akan tolong present ke specialist lah. But you need to be able to present those cases yang you review. Okay. Okay, so what you need to learn during tagging, kita recap. Okay, basically apa yang saya dah mention tadi. Okay, so you need to clerk, review and manage common cases. Okay, so clerk ni first admission. Okay, in between kita pergi buat discharge, kita pergi buat procedure, kita request scan, akan ada new case masuk. So you need to learn how to clerk. So usually kalau ada taggers dalam ward, new cases memang kita akan bagi taggers untuk clerk. Sebab apa? You need that experience of assessing patient on your own. Okay, so lepas clerk, lepas tanya set of questions, okay, you need to document, you need to document the physical examination finding as well. You need to decide the investigation to order and plan of management. Okay, so plan, okay, macam mana, soalan apa nak tanya, investigation apa nak order, plan apa nak buat. Don't worry, usually you boleh belajar daripada BHT. Kalau dalam satu ward tu contoh medical kan, bukan kalau patient tu masuk uncontrolled diabetes. Okay, mungkin bukan satu patient je, ada beberapa patient lagi uncontrolled diabetes. So ambil masa untuk tengok how your senior houseman clerk the same cases. Kalau pneumonia, biasanya kalau patient pneumonia masuk, kita akan tanya the set of same question. Kita akan order the set of same blood investigation, and kita akan dia punya plan of management pun akan more or less the same lah. Okay, kalau yang dah belajar dekat online course Medicorp, management is your ventilation, okay, or intake or IV drip, what other things you want to monitor in your patient, medication, and ada special order lah. Okay. Okay. Okay, ada soalan, ada komen baru. Okay, so Muhammad Irfan tanya, review pagi, present to MO. Do we need to write review by MO? Then kena present dekat specialist juga kan? So must write 2 times ke review. Okay, yes, betul. So, Solihin dah tolong jawab. So, biasanya bila you review patient on your own, so you write lah AM review. Bila ada MO datang, okay, depending on your MO and whether your review first time tadi complete atau tidak. Kalau review complete, biasanya MO izinkan tulis seen by, okay, dekat atas AM review tu, seen by, okay, MO nama siapa? Dr. Iliana pukul 8, okay, contoh. Tapi kalau bila specialist datang, usually we need to write a new entry lah, okay. Kalau Community Hospital mungkin lain sikit, okay, but every time different MO come and review patient, you kena document dalam patient punya file lah, okay. So kalau computerized system, kena ada entry yang baru setiap kali, ada different doctor, whether MO, whether houseman, MO atau specialist review, okay. Berapa kali kena review, depends lah. Biasanya houseman kena review sendiri. So kalau Yes, macam Khairi Syahmi cakap, kalau MO you datang lebih awal pada specialist, so first review by houseman, then seen by MO, seen by specialist. Kalau ada grand walk round, then seen by your consultant. Okay, tapi sometimes houseman datang MO, then specialist datang dengan consultant, so seen by MO, seen by specialist sahaja. Okay, it depends on your department lah. Okay. Okay. Next, kena belajar apa? Okay. Second, okay, you kena faham tadi waktu lepas off-tag kita mungkin kena jaga ward sendiri. Okay, so you need to know how to identify common ward emergencies and unstable patient. Okay, so bila you identify, you need to know how to manage. Okay, how to manage tu maksudnya kalau patient, contoh apa patient shortness of breath, so you need to know manage ni apa yang you kena assess lah. Okay, kena check contoh SpO2, auscultate, mungkin ambil ABG. Okay, so when to call for help, so nak kena call siapa, nak kena call tu nak cakap apa pun kena bagi tahu. So you tak boleh call him, oh okay boss ada patient complain SOB, bed 12, tak boleh. That is what your nurses inform you. You can assess, you can examine, there's set of investigation you need to order and interpret and report to your MO. Okay. Okay, so kalau OT, kalau surgical based department, you will need to tag in OT as well. Okay, for example, kalau ONG, at least you kena assist 3 cesarean section, that is for my previous hospital lah. Okay. So kalau dekat OT ni you kena learn, you need to learn how to scrub, means cuci tangan betul-betul, how to wear the OT gown. Okay, how to comply to the aseptic punya SOP. Okay, and then how to assist common operation. Okay, sebab bila you off tag, kalau you dah off tag tu, mungkin dalam roster tu you jaga ward, mungkin juga you jaga operation. Okay, dekat OT. So kalau dekat OT you are the only assistant yang MO you ada. Okay, so operating surgeon tu akan ada seorang houseman je untuk assist dia. So we really need you to function lah. Okay. Okay, I think that's all. Actually banyak lagi benda yang Tegas kena belajar. Okay, but this is the main overview lah. Okay, kalau yang lebih detail tu saya akan cover dalam mentorship punya program dengan Pre-Show online lah. Okay, ada kalau ada soalan boleh tanya dekat komen. So Irfan tanya, Tegas boleh order investigation ke? Boleh, any investigation yang houseman boleh order, any senior houseman can order, you can order. Okay. Cuma ada certain investigation yang memang bukan houseman boleh order lah. Contohnya, kalau my hospital, any blood investigation, routine X-ray, houseman boleh order. Cuma kalau ultrasound, itu by MO. Okay, you kena discuss dengan MO. Dekat form tu pun kena signature MO lah dan chop MO. Kalau CT, MRI from ward, must be ordered by specialist. Okay, certain blood investigation yang perlu special region, okay, more costly. For example, tumor marker, need to be ordered or countersigned by specialist. Okay, but most of routine investigation, chest X-ray, ABG, full blood count, renal profile, yang tu houseman boleh order. Even Tegas can order lah. Okay, kalau ada indication, tak ada contraindication, by all means you need to proceed. Okay, I think that's all from me today. Thank you everyone who has joined the live session, okay, and watched together. Okay, thank you for watching. See you in next session lah, insyaAllah. Or see you in our other program, clinical skills workshop, Pre-Show online, and we'll start our departmental online courses as well soon. Okay, Assalamualaikum, all the best. Please prepare yourself well before tagging, especially yang nak expect upcoming intake ni. Okay, so you dah tahu apa yang you kena, what is expected from you as houseman, as tagger. Once you step into the department, when you step into the ward as tagger, we expect you to somehow function lah as your senior houseman. Okay, so Tegas ni bukan masa untuk tengok-tengok. Okay, Tegas ni masa untuk jadi houseman lah. You need to do what is expected from you. Okay, so please use all the time, the luxury of time you have during this pandemic to prepare yourself well. Okay, insyaAllah see you in next session. Okay, Assalamualaikum.